Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Today we'll talk about Black people face strokes at higher rates, younger ages than white people. Black people consistently had a higher rate of stroke than white people over a recent 22-year period, according to a study published in the January 10, 2024 online issue of the Neurology, the medical journal of American Academy of Neurology. The study also found that the average age of black people experiencing stroke was nearly 10 years younger than that of white people, another inequity that grew over time. We found that the rate of stroke is decreasing over time in both black and white people, a very encouraging trend for the US prevention efforts, said study author Tracy E. Madsen, MD PhD of Brown University in Providence, Rhode Island. But there was an inequity from the beginning of the study, with the rate of stroke always being higher for black people than their white counterparts. The disparity did not decrease in 22 years, especially among younger and middle-aged adults. Researchers evaluated stroke trends over time using data from hospitals in southern Ohio and northern Kentucky from 1993 to 2015. Stroke cases were recorded across a full year every 5 years, about 1,950 cases per year for a total of 9,728. Using US Census data, they were able to calculate stroke incidence rates per 100,000 people.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The overall rate of stroke decreased from 230 cases per 100,000 people in 1993 to 188 cases per 100,000 people in 2015. For black people, the rates went from 349 to 311, and for white people, the decline from 215 to 170. The rate of stroke among black people continued to be 50 and 80% higher than the rate among white people across the 22 years, even after adjusting for age and sex, a disparity that was particularly stark in younger and middle-aged black adults. The disparity shrank in older age groups, a difference the researchers say may be due to different survival rates of black and white people. While the rate of stroke was decreasing, the study found that strokes were occurring at a younger ages over time, and this change was larger in black people, exacerbating the existing disparity. Stroke struck black people at an average age of 66 at the beginning of the study and at age 62 by the end of the study. For white people, the average age was 72 at the beginning of the study and 71 2 decades later. These disparities present a major ongoing public health concern, Madsen said. More work is clearly needed to address systemic and policy problems as well as factors that at the provider and patient level. These findings are a clear, urgent call for concrete efforts to build more equitable means of stroke prevention and care. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.